Well, community health, in my opinion, means more than just the amelioration of disease and illness.
To me, building healthy communities is helping our gente.
A huge opportunity for families to be engaged.
The opportunity for youth to explore careers.
In order for us to succeed and help this community, we need to work together, and that's one thing they're bringing to this community.
Having the California Endowment and the Building Healthy Communities initiative here in Coachella has really helped support some of those small nonprofit organizations.
Building healthy communities, to me, represent one of the greatest opportunities that the Eastern Coachella Valley has ever had since the last 10 years. The program creates a lot of opportunity and leverage a lot of resources to the communities we serve. Pueblo Unido is definitely committed to work with the vision of the Building Healthy Community and providing new opportunities, new resources, and more importantly, trying to get the community organized, engaged, and participate in helping us to define which are their priorities so that they can improve the living conditions and consequently environmental health.
Well, Building Healthy Communities has really helped to galvanize the community around health issues, nutritional information, and education of students and parents and the entire community. So what they've done is really brought that focus into that particular area and allowed us to partner with them to get the information out to students and parents as well.
Well, I guess I'll begin by really acknowledging the efforts that have taken place by many of our community members who have really decided that working collaboratively, right, on issues of change in our community is a top priority. And so in this particular case, we were very fortunate enough as a city and a region, the Eastern Coachella Valley, to be selected by the California Endowment as one of 14 cities to develop a strategic plan to address the health disparities, but at the same time initiate an effort to really craft systemic change through policy implementation.
I started interpreting for the city and translating some of the materials. It has been a growing opportunity for me because speaking up and speaking in front of others is very difficult for me. So I've gained a little bit of more self-confidence and just of the feeling that I'm going to be okay even if I mess up.
Well, community health, in my opinion, means more than just the amelioration of disease and illness. You look at the definition of World Health Organization, they'll say that community health also means making sure that our kids have sidewalks, for example, to walk to school, making sure that people have clean drinking water so they can bathe and drink and wash their dishes. Making sure that we do everything we can to provide cultural arts, for example, and music festivals like this one here in Coachella, so we can prevent youth violence.
First of all, I feel honored. I always feel honored when I have the privilege of speaking with people that have an intention and a vision to help the community. I also feel hope because I know this concept that we talk about, la cultura cura, really the basis of that is that within the spirit of every individual, of every family, of every community, of every culture, is the wisdom, is the medicine, is the possibility for healing, sacred growth, leadership, and development.
Through my involvement with Raíces Cultura and the Youth Participatory Action Research Project, I think I've seen a lot of efforts starting to kind of work together on some of the issues that are affecting the youth here in the Eastern Coachella Valley. I feel that having the California Endowment and the Building Healthy Communities initiative here in Coachella has really helped support some of those small nonprofit organizations that have been working maybe previously and building that capacity of youth. I personally have been really, I feel like I've changed a lot in terms of my perspective of what it is to be a resident here in the Coachella Valley, and I think that the support that we've received has really helped in having our youth develop some of those skills to be more engaged in their community.
Building healthy communities is very important, and very happy that they're out here. Helped me a lot with my Boys and Girls Club. They gave us a grant to, we're able to do a healthy habits program with our kids, teaching them how to eat right and how to make healthy snacks. And if it wasn't for them, for that grant, I don't think we were able to do this program, but I'm happy that they're able to help us.
I don't know where I would be without BHC, honestly. I think it has impacted my life tremendously. I would have never gotten involved in any type of leadership roles in my community if it weren't for BHC, because there's none. So.
And that's kind of where this White Power Project helped you identify opportunities for youth, correct?
Mm-hmm. Yeah, it has, because not only has it involved me, but a lot of youth, not only from Mecca, but from North Shore, Oasis, Coachella, Thermal, so that has really impacted all of us, you know, because before we didn't know what to do, we didn't know what was wrong with our community. Yeah, I mean, we were aware of it, but nothing was being done about it.
They sent me out to a camp, and through that camp I got to learn a lot of good things and different ways to come back to this community, to bring back what they taught us to the young men and the boys of color that we can help out here, and teach them what I was taught over there, and a lot of it, you know, some healing circles, just to continue to help these young people to believe in themselves. And I just think, you know, that BHC is out here to help us with those things, and bring what they know to bring us together and make things happen out here.
I'd like to see space on this board for our youth. So if you'd like a youth member to sit on this Parks and Rec board.
Well, I think BHC is, I feel right now that it's been a great opportunity for the Eastern Coachella Valley. They provided some awesome space and opportunities for us to grow out here and to create a healthier community. And as far as me personally, it's allowed me to basically just jump in and help my community and not be afraid of creating opportunity.
I think the most exciting part of the BHC for ICUC in these last 2 years has really been the collaboration work we've been able to do. Not just as the organizers with other organizers, but our community people really being engaged in the BHC work beyond just the local campaigns that we're organizing in the different congregations. So if we take transportation in North Shore, our North Shore group has been able to work with other folks like Líderes Campesinas, CRLA on other issues, not just relating to transportation, food access, recreation, just all sorts of different topics.
Since its conception, I've been actually involved with the whole process. So I think it's been almost 4 or 5 years I've been involved with this whole process. And in the last year, I've really stepped in and accepted the opportunity to reactivate the Parks and Rec Commission. And that was something that we got reactivated, and we pushed that through the city of Coachella, and we had the opportunity to have many meetings for the community and residents to come and talk about Parks and Rec and what's important to them and why we need to have a Parks and Rec Commission or committee to have a voice to be able to bring certain activities that we don't have but that we need to have in our community.
We had a letter of support campaign going on for a couple of weeks between ICUC, the Sunlight, and we asked our different partners to send out letters of support. It was really encouraging and really exciting to see that all of our big partners that have been engaged in this work that isn't maybe a campaign that they're directly working on. We're supportive in sending letters of support for the North Shore community, for the organizing work, to Riverside County Transportation Commission to make sure that our community and our families have access to public transportation.
Margarita gave me a lot of assurance that there were people here in this valley through the collaborative, through BHC, other partners who were doing really interesting work that Health Corps could partner with, and she was totally right. As soon as I came on board, I had partners who made key introductions across campus, across the community, who welcomed me just in the valley as a place to call home. But in huge events as well. So Dr. Oz, who's our organization founder, came, I think, I don't know, less than 8 weeks from when I started, very, very soon. And Building Healthy Communities helped me make those contacts and make that event a success. And it genuinely was. We had students, volunteers, we had donors, we had donations, we had sponsors, and I couldn't have made that happen as a newcomer to the Valley.
You know, I think, Trini, the most important thing is what we have done is we have partnered up with different social service agencies to really try to get ahead of the problem. Instead of kind of being reactive and being there to just serve these individuals, we've done it more under the pretense of what can we do to help them get off the food line now. And, you know, usually when you're on the food lineup, it's because you've been faced with all these other social type, you know, situations, call them. And so one of the biggest things that we found that was most successful was we were partnering up with groups of agencies going into some of the mobile home parks that you're very familiar with and creating an environment that is basically as much self-sustainability as possible. And so that self-sustainability can be as to getting these people on food stamps. It can mean getting them on WIC for the little kids. It's eyesight testing for children. It's getting them hooked up to medical clinics that can see them for free when they can't get access to some sort of medical coverage. Even to the point where we did stuff where we had agencies come in that would talk about domestic violence or alcohols or drug addictions. But the ultimate thing with these mini health fairs that we called them was we kind of went into a community, into their own backyard, and created an opportunity for them to ask questions and to really guide them on what was out there. And so when we left, we all kind of could look at each other and going, okay, this is now a community in the know. And they are now accessing the services they need to basically live their lives the best they can in this economic picture that we're dealing with.